Be cautious, the warning from Health Minister Dr. Christopher Tufton as he urges the opposition to stop creating panic among staff and the public about the challenges at the Cornwall Regional Hospital in St. James. He insists that he has nothing to hide and took the media on a tour of the facility on Friday. It appears that the vents at Cornwall Regional Hospital aren't the only things fuming, since the parliamentary opposition toured the facility deeming the state of affairs as chronic. The air between them and the government has gotten steamy. However, following a media tour of the facility on Friday, Health Minister Dr. Christopher Tufton attempted to set the record straight.
I think it's important that the people know, not just patients and citizens, but the internal stakeholders who are here, the external stakeholders who look on, including the opposition. I think it's a national challenge. It's a national crisis. It requires a national response, and it requires the engagement of all of us if we are to act truly in the interest of making the facility better, to the best interest of the citizens. And in that context, I have absolutely no difficulty with just being transparent and sharing the information.
He ferried the press throughout the affected areas of the facility, revealing its current state and the work being done. It was evident that the walls of floors 4 through 9 had been gutted. Minister Tufton explained that this is in preparation for renovation. As such, he's urging the opposition to be cautious about creating unnecessary panic.
It may be injurious to the welfare of the citizens who we serve, vis-a-vis giving the suggestion that the building doesn't work or healthcare isn't working because the building has challenges, when clearly the services or many services are still being provided. And secondly, caution against the blame game that is being suggested, if not explicitly stated, that it is the burden of one administration versus another. Because as the history suggests, this is a burden that we all have to bear.
Dr. Tufton says his ministry will be tackling the challenges with a fulsome approach.
We don't want the staff, the workers, to be demotivated and to feel as if the work that they're doing, despite all the challenges, is not being appreciated. That's another consequence of those criticisms. The doctors and nurses and administrators have done a lot. They have had to suffer a lot in doing so because this is not normal times. And we want to just express how much we appreciate the work that is being done.
The noxious fumes caused by mold from the ventilation system and the chimney stack resurfaced recently, causing more issues for the hospital staff.